Psychiatrists are trained to deal with people in crisis. But some are now having their own crisis of confidence when it comes to medically assisted dying.
Our role as therapists, as psychiatrists, is in suicide prevention. And so to ask us to then facilitate suicide is very dissonant.
The laws around medical assistance in dying, or MAID, are set to expand, including Canadians with mental illness. But medical experts across the country warn Canada's healthcare system is not ready.
And we already know there's not really clear consensus on a definition of, for example, what it means for someone to have a mental illness that is incurable or irremediable. So we already know there's this risk of inconsistent application of MAID.
When MAID became legal 7 years ago, only patients with a terminal illness were eligible. In 2019, a Quebec judge ruled this restriction was unconstitutional, so Parliament amended the bill.
In my view, mental illness is no different than any other medical illness. I believe that doctors are quite capable of assessing people with psychiatric illness and coming to the same conclusions that they have for people who have, cancer or lung disease or neurological disorders.
But families of patients worry there are not enough protections.
We are so angry and insulted at how they just all turn their heads.
Tricia Nichols told a parliamentary committee that her brother Alan was suicidal when he checked into the Chilliwack Hospital July 16, 2019. 10 days later, he died with medical assistance.
How can our government even be looking at expanding MAID laws? There are currently no laws protecting the vulnerable or their families from MAID.
We understand that making sure we're respecting people's rights and their choices at the same time as we protect the most vulnerable is a very important but challenging balance to establish.
Psychiatrists fear that balance will be even harder to strike with the healthcare system under immense pressure.
Telling my patients that you will make it easier for them to die has enraged me. They will die because of lack of services. They will die because psychiatrists will now have legal permission to give up.
The parliamentary committee studying the issue still has to release its final report. If Canada goes ahead with the amended legislation, we will have some of the most lenient assisted dying laws in the world. Touria Izri, Global News.